When we purchased this office, it was doing around $65,000 a month. In December of this year, we did $205,000 in revenue. So we're able to triple the revenue by adding some of these services and getting training, getting the team on board. And so it's a huge win from a business standpoint, but honestly, just from a personal fulfillment standpoint too. I'm Dr. Shah. I'm originally from Ann Arbor, Michigan. Our practice here is in Plymouth, Michigan. And I've been practicing here for the last 6 years. For full arch implant dentistry and really Invisalign, or I think any kind of specialty procedure, the two biggest, most important roles you need are a patient representative and a treatment coordinator.
Dr. Shah has been known to give his personal cell phone out to patients. We are an open book here from the time that they walk into the office to the time that they meet the assistants and the doctor. We'll follow up with you. Look, it was great meeting you. If you have any questions regarding treatment, the process, anything that you could think of, please don't hesitate to reach out, because that's what we're here for.
When patients call, ideally you want to pick up within 2 or 3 rings. And then ideally you want to have a consult within 2 or 3 days. We've had patients that came in to see us just because they like the sound of our treatment, our patient representative's voice. So it's really important, right? And then once they're here, you got to have a great treatment coordinator. Someone that knows the financials, but also someone that's kind, someone that's caring, someone that patients relate to.
So when I speak to the patients on the phone, I talk to them as if I'm talking to them as my best friend. I'm listening to them as opposed to just throwing a bunch of information all at once and not really listening to what the patient wants. Making sure we understand what they're looking for, where they're going, and what's feasible for them is super important. We want to make sure that they're people first before patients.
This is something where if you don't have a team that's able to build rapport, that's able to build relationships, you won't be as successful. Marketing, in my opinion, is the lifeblood of any successful dental practice, right? I mean, we hear stories of practices that were in business for 30 years and did no marketing, or maybe they had a yellow page ad. Unfortunately, that's just not possible in today's environment, right? If people don't know about you, doesn't matter if you're the best dentist in the world, you're not gonna have great success because no one is coming to your practice. And now there's 10 different places to market, right? You have TikTok, Facebook, Instagram, Google, print media as well. And so I think having someone that truly understands these mediums is gonna really maximize your ROI on your marketing dollars, right? Because we've all heard those stories. You partner with a random company, you pay them a bunch of money, there's no metrics to track anything, and you have no idea if your marketing worked, right? So some of the people that Guardian has working with us on the marketing standpoint are so amazing because they know how to get, quote, unquote, butts in seats, right? We got to get people through the door for our practice. Without that, all the things we talk about the doctor being motivated, the team being motivated, mean nothing.